Hello, I'm Dr. Julie Wickel, and I'm a veterinarian here at Claws and Paws Veterinary Hospital. Today I'm going to talk to you about dental disease and teeth cleaning. Over 85% of dogs and cats 3 years of age and older have some form of dental disease that requires either treatment or preventive care. Just as in people, plaque and tartar build up on the teeth of all animals. Left untreated, this can lead to gingivitis, which is inflammation of the gum tissue, periodontitis, which is inflammation of the supporting structures of the tooth. Bacteria can go to the lungs, the heart, the liver, and kidneys. Abscessation of the tooth can occur with eventual tooth loss. Now, how do we know? How can you tell at home that your pet has problems with his teeth? Bad breath is the first thing that you notice. Bad breath is not normal in our dogs and cats. The second thing you can do is look inside your pet's mouth. Look at the back and the side teeth. This is where tartar builds up the first. Look for inflammation of the gums. Look for any swellings. Look at how your pet is eating, Do you notice that food is being dropped or the pet is salivating more? Unlike people, pets do not realize that there is something that can be done about their teeth. They will go on acting normally and eating as long as they can until that problem becomes too big to ignore. Most pet owners do not realize that there is a problem in their pet's mouth until the pet stops eating or there's a swelling that occurs around the mouth. One concern of pet owners is anesthesia. Before your pet is given anesthetic, a full thorough physical exam is performed. Any blood work, EKG, any lab work is done at that time. Your pet is then anesthetized and intubated. A technician cleans the teeth and monitors anesthesia. We use an ultrasonic scaling and polishing unit, very similar to the human dentist. A veterinarian oversees the process, looks inside the mouth. Dental x-rays are taken, and these are very important so we can check and see what's going on below that gum line. It often happens that an apparently healthy tooth, when viewed on x-rays, will have either a tooth root fracture or an abscess, at which time we call you to discuss further treatment options. Once your pet's teeth are cleaned, he is awakened, and he can go home that same day. Our anesthesia is that gentle and safe. Another concern owners have is money. Why is it so expensive to clean my pet's teeth? Well, what we have to keep in mind is when you and I go in to have our teeth cleaned, we don't have to be sedated, we don't have to have blood work, IV catheter, any of that done. Anesthesia is much safer for your pet than letting dental disease go untreated. Teeth cleaning is not an elective procedure. It is just as important as physical examination, heartworm testing, intestinal parasite exam, vaccinations, and routine annual blood work. This is not something that can be ignored for the health of our babies. How often your pet needs to have his teeth cleaned depends upon breed, size, age, and how much you can do at home, plus how rapidly that tartar builds up. For example, smaller dogs and cats will need to have their teeth cleaned starting at a younger age and more frequently than, say, if you have a lab retriever. So what can you do at home? Brushing your pet's teeth is the most important thing that you can do. This will help physically remove the calculus and tartar before they can build up. As far as toothpaste, you don't want to use human toothpaste. What you want to use is dog or cat approved toothpaste. Our toothpaste has too much fluoride and detergents that are not designed to be swallowed. Okay. The toothbrush that's used has two ends on it, one a little bit larger than the other to reach those back places. Now, how do we go about brushing your pet's teeth? What you want to do is first get your pet used to you just putting your hands along the cheek and rubbing, and then putting your fingers inside the cheek pouch. Once your pet accepts that quite readily, then you can get the toothbrush, or we have a finger brush. Now, if you use a finger brush, remember, your fingers are inside your pet's mouth. Once you have the brush, what you want to do is just get your pet used to you putting the brush inside on either side of his mouth. Once he accepts this, then you can start slowly touching the teeth with the brush. Now, one thing you can do to help, you can go two different ways. One is, say, if your pet likes peanut butter. Put some peanut butter on the toothbrush, firmly hold on to that toothbrush, and put it inside your pet's mouth and just let your pet chew on the toothbrush. You can slowly guide to where you can start brushing your pet's teeth. Again, don't go too far. If your pet shows any type of resistance, go ahead and end the process that day and start again the next day. Another thing you can do is, a lot of our pets like the flavor of the toothpaste that we have for them. Go ahead and put that on the toothbrush and do the same thing. Get your pet used to you brushing the teeth. This may take more than a week. It may take 2 to 3 weeks. But if you're calm and if you're patient, then the majority of our pets will allow you to brush their teeth. Another thing, if your pet won't let you brush his teeth, we have different products that you can use. This is a rinse that can be squirted inside of the mouth, and the tongue will move it around the teeth, okay? And this is a product that you can add to your pet's drinking water. It's supposed to be tasteless and odorless. I say supposed to. Most pets accept it readily. And between these two, they help with tartar buildup and bacteria inside the mouth. If your pet won't let you do those, or even if your pet will let you do those, say for example, if you have a little poodle, I would do as much of these as I can. Another thing that can help your pet's teeth is a special diet. These dental diets are designed to help physically remove the plaque with your pet crunching the food, and also they have enzymes designed to help decrease the tartar buildup. Now these guys I love. These are called CET chews, and they are double coated with an enzyme that, when mixed with saliva, helps break that tartar down. They also help with your pet's breath. Now, one thing that I forgot to mention is, once your pet's teeth are scaled and polished, then this is a product, Orvet, that is applied to their teeth. This is a kit that we send home with you that once a week you apply to your pet's teeth. And what it does is it helps prevent the bacteria from building up and attaching to your pet's tooth. I know this seems like a lot for you to do, but keep in mind, the more you can do at home, the less we have to do up here. And a healthy pet has healthy teeth. For more information on this, please feel free to look at our dentistry handout on our website or call one of our friendly staff members. Thank you.